and welcome everyone to the 2023 Virtual Compassion in Action Healthcare Conference. I am Dr. Michael Goldberg, the scholar in residence at the Schwartz Center, and also with this group from sunny downstate, it's where I graduated in 1964. I want to thank you all for joining us for this discussion on Together We Grow, Achieving a Culture of Empathy in Medical Education to Enhance Learning Across Generations. The group here today who will conduct the conversation are all from State University of New York, Downstate Health Science University in Brooklyn, and the New York City Health and Hospitals in Kings County. Dr. Teresa Smith is Associate Dean of Graduate Medical Education and Affiliations, Interim Chair of the Department of Emergency Medicine, and Professor of Clinical Emergency Medicine. Dr. Melanie Cheng is a Clinical Assistant Professor of Pediatrics. Dr. Elke Jacobson-Dickman is the Associate Dean for Clinical Medicine and an Associate Professor of Clinical Pediatrics for the Division of Pediatric Endocrinology. And Dr. Jody Ann Edwards is a General Surgery Resident Physician and Research Fellow. And Dr. Lana Irons is an attending physician with the New York City Health and Hospitals Domestic Violence Shelter Mental Health Initiative. So welcome to all of you. We look forward to this very timely conversation. And I will turn this now over to Jody Ann.
Thank you. We'll just pull up our slides. Thank you. Okay, so yeah, we will be talking about how we can grow together in a culture of empathy in the medical education and also the workplace to enhance learning across generations. I'm Jody Ann, Jody. My pronouns are she, her, and hers, and I belong to the millennial generation. As an equity practice, we agreed before this talk to refer to each other by first name, and also to share our generation and our pronouns. So while we're talking about our experiences or our thoughts on our particular generation, we want to just express that we're not speaking on behalf of the entire generation. And also our panel does not include all generations either. But thank you and welcome to our talk. We have no disclosures. And now I'll hand off to Lana for the objectives.
Thank you, Jody Ann. My name is Lana Irons. My pronouns are she, her, and hers. And I also come from the millennial generation. So in regards to our objectives for our workshop today, what we're hoping for the audience to take from our presentation is we want people to be able to define the generation gap and its relevance within the clinical learning environment and work environment. Discuss the challenges and benefits of intergenerational medical education. Discuss the need for bidirectional learning in the ever-changing medical landscape and the role that a culture of empathy and mutual admiration can play in enabling progress. Identify strategies to break down barriers and foster mutual respect for professional growth, and develop tools to improve communication, navigate intergenerational conflict, and capitalize on generational strengths. So for a little background, as we begin our talk. So in a way, for the first time in history, there can be up to 5 generations sharing the working and learning environment in medicine. With this sort of circumstance comes in a context of changing systems of medical education. This can include changing values as well as the expectations of both educators and learners in the medical system. This is all impacted by the rapid pace of technology advancement. I'm thinking in the past 2 decades or so, we have the introduction of an electronic medical record system, telehealth, and even more recently, the advent of artificial intelligence and how that can kind of affect the delivery of healthcare as well as how people interact within the healthcare system. This all these different changes, as well as the fact that many different places and work environments in medicine have intergenerational teams, presents both new challenges to learning as well as the work environment, but also new opportunities to collaborate and to lean on the experiences of all the generations. And I want to pass off over to Melanie.
Hi, I'm Melanie. My pronouns are she, her, and hers. I also come from the millennial generation, although I would say I identify on the older end of the millennials. So I just want to go through a little bit of the timeline of the current generations, especially those that are in our workforce right now. And I want to just start by giving the broad definition of what a generation is, and especially for the purposes of this talk. So it's a cohort of people who are born and living at the same time and who collectively experience the same or similar historical, societal, and cultural events that really shape the lens through which they see and approach the world. So it's often thought of as being around 20 years, although there is no specific set time frame. And there's a lot of, kind of newer discussion on whether or not this will start to shift in and become shorter periods of time with the rapid advances of technology. And I want to also briefly define what the generation gap is as we move into our discussion. So the generation gap is a difference in values and attitudes between one generation and another. It's often thought of when it comes to parent and child relationships, and the idea that the older generation are the parents and the younger generation are the kids don't understand each other because of their differences in experiences, opinions, habits, and attitudes. Although this we can see in many intergenerational teams in the workforce as well. So just going through the overall timeline and some of the names that have been given to the various generations. So the greatest generation is from 1924 and before by most definitions. It is called the greatest generation really from the fact that they grew up during the Great Depression. And then next was the silent generation, also known as the traditionalists. And they grew up in the shadow of the Great Depression. And their name really comes from the fact that they worked within the system rather than trying to be outspoken and changing it. And then came the baby boomers. This is one of the largest adult generations currently. And they're children of the population surge that came following the war, which is why they were called the boomers. Gen X is a much smaller generation than the baby boomers, largely because this was around the advent and availability of birth control. And then came the millennials, and their name, stemmed from when they came of age in the new millennium. And then next is the youngest generation we currently have in the workforce, which is Gen Z. And now I'd like to turn it over to Teresa.
Great. So we would like to start off with an interactive activity so that we can really get to know our audience. We'd like everyone to use Poll Everywhere. You can join by going to the website pollev.com/TeresaSmith663. You can also use the QR code, which we're going to bring up in another screen in a second, or you can text 37607 and you're going to send the message Teresa Smith 663. I'm going to stop sharing momentarily. Okay, again, we have our QR code. And our first question is, what generation do you belong to? Just refresh. Great. We'll give everyone a few minutes to go in. And while they're doing that, I just wanted to make sure that I reintroduce myself as well. I am Teresa. I go by the pronouns she, her, and hers. I also am a millennial, but really identify as a zennial because I'm right at 1981, which is the beginning of the millennials and the very end of Generation X. We'll give everyone a few more seconds just to make sure that they can sign on. And stay on that website or the text message because we have a few more interactive activities. So it looks like we are currently about 46% millennials, 42% Generation X, and 12 to 13% boomers. Okay. So our next question. What comes to mind when you think of Generation Z? Great. So we're getting a lot in. Use one word if you can. Young, tech, innovation, self-advocates, savvy, gamers, independent. Great. Entitled, authentic, TikTok. Great. Teachers. Okay. Now, in one word again, what comes to mind when you think of millennials? Good. Spoiled, worker, thinkers, entitled, lazy, forward. Entitled is definitely the largest. So if you guys know how to word cloud works, the word that's used most frequently ends up being the largest word. So it looks like from our audience, when we think of millennials, we think of entitled. Trophy kids, empowered, GOAT, student loans, misunderstood, overachievers, complacent. Good. You've probably been hip to what we're doing now. We're going to think of thoughts for each generation. So what comes to mind in one word when you think of Generation X? Good. So hippies, structured, old school, latchkey, optimistic, loyal, go with the flow, stoic, judgmental, traditional, resilient, hardworking, optimistic, sandwiched, judgmental. Good. We have a couple more. And what about the boomers? What's the one word that comes to mind when you think of boomers? Rigid, judgmental, traditional, lucky, retired, critical, dedicated, conservative, nurturing, disgruntled, mentor, stubborn, achievers, lucky, judgmental, privileged. So the three top words are rigid, conservative, and traditional. And finally, let us not forget the silent generation, otherwise known as the traditionalists. What comes to mind when you think of them? Good. Conservative, respect, wise, resilient, stoic, racist, wisdom, mentors, outdated, inspiring, resourceful, trauma, hidden, responsible, loyal. Good. Strong, old, wisdom, hidden smarts. Thank you everyone for participating in this activity. This really is going to be the start of a conversation where we reflect on each generation and maybe even reflect on our own biases of that generation. So I'm going to stop sharing. And I'm going to pass it on to Elka.
Hi, everybody. I'm Elka, and my pronouns are she, her, hers, and I belong to Gen X. But as Teresa said, I think as many of us who sort of are at one of the tail ends of these generations, I do feel that I have at least some shared understandings, if not relate quite well from a millennial perspective as well, because I really do feel I straddle, but I am Gen X and in many ways relate most in that group. So, really, who are we? What are these generations? And a lot of what we've touched on so far sort of rings very true. As Melanie alluded to already, generations share sort of contemporary political and social events. And they've often experienced certain similar parenting styles. So at the risk of, painting an entire group of individuals with one brushstroke, this does often result in sort of comparable personal and professional values, work ethics, communication preferences, and leadership styles. And what this table offers is really sort of this comprehensive overview of some of these events that have shaped us, and our personal work characteristics and our styles of communication and attitude towards technology. And while I won't go through the entire table, I do just want to point out a few salient details about each generation, if I could. So starting with the traditionalists, they lived through the Great Depression and World War I. Their parents typically married young and were very unlikely to divorce. This often resulted in individuals who were loyal, obedient, unlikely to challenge authority. In the workplace, these were people who were value stability and job security and communicate quite formally. Technology was not really factored. Baby boomers were typically raised in traditional family structures with maternal figures working in the home and paternal figures working hard in their jobs. However, they lived through civil rights and women's movements, Vietnam War, the advent of television, and economic prosperity. They tended to be optimistic, desiring of change and progress, competitive in the workplace, and sometimes they were referred to as workaholics. Gen X, to which I belong, as mentioned, saw the fall of major institutions, political scandals, AIDS, divorce, computers. They were more likely to be raised in less traditional homes, to be called, as we heard from the audience, latchkey kids, and maybe babysat by television. Gen Xers are often characterized as fiercely independent, self-directed, and resilient. They are more interested in work-life balance, perhaps, than their predecessors, and more likely than they were to question authority. They are described as blunt in their communication style, and the first generation to have some facility with technology, although I'll admit my kids would disagree. Millennials were raised in economic globalization, 9/11, and the post 9/11 geopolitical environment, multiculturalism, and technology boom. They were raised by the quote unquote helicopter parents and had play dates arranged for them. They're often characterized as optimistic and in need of praise, and collaborative with global outlook. As a result, in the workplace, they are team-oriented and they work well within structure. They are far more polite than Gen Xers before them and extremely tech savvy. think we can go on to the next slide. And Lana, if you would.
Thank you. Yes, and so I have the opportunity to present Gen Z. Although I am technically a millennial, I was born in the early 90s, so I happen to be a young millennial, so very close to Gen Z. And in this particular site, we have Gen Z as 1999 to 2012, but sometimes 1995, 1996 is considered the first sort of years of Gen Z. In regards to this particular generation, which at this time is kind of going into medical school and really started joining the workforce and joining the workforce in medicine, medical school, nursing school, that sort of thing. Various societal events that they experience include the aftermath of 9/11, the effects of the 2008 financial crisis on their parents and families. They were born into the internet age. Also the greater sort of school shootings and what that entails in regards to feelings of themselves and their safety within the school, within the educational environment, natural disasters, online hacking and bullying, especially with the information that is put online. And more recently, COVID-19, as they are entering the workforce and how that affected both their education, but also their first sort of connections to the workforce. Their childhood family characteristics, they're more likely to be children of immigrants, actually more likely to come from non-white families, more likely to have college educated parents, and parents who happen to be more collaborative in regards to their parenting styles. Personal characteristics include active problem solvers, independent learners, not as interested in sort of a lecturing classroom, and really focused on active advocacy in regards to social justice, equality, fairness, and the environment, and really adding that advocacy into whatever sort of job, whatever place in which they find themselves in. Like I said, most diverse generation in regards to race, gender identity, expression, and sexual orientation and how they identify. Some work characteristics that and this is still kind of an ongoing thing as we study this and we looked at various different reports on this, research, that sort of thing. This is new, but it's starting to come more clear that generally they want more frequent check-ins, close mentoring relationships, and really interested in how they can show up as themselves to work. Some education characteristics, they've actually found that there's less likely to drop out of high school and actually more likely to be enrolled in college. Like I said, they prefer frequent check-ins, focus around negative, positive feedback, and a lot of it through texting and through sort of non-traditional ways and very informal ways of communication. And technology-wise, digital natives, really one of the first generations where they were kind of born into the use of technology in their everyday lives. Although I happen to be a young millennial, I remember sort of how my family didn't really have a personal computer. We had one, but nobody really used it kind of when I was really, really young. But but with them, with the Gen Z, it seems that they really did grow up in this hyper connected world. And I think it's Melanie next, actually, if I'm remembering correctly.
I think we're turning it over to
Elka.
Elka.
Okay, yes. Sorry about that.
No, that's great. Sorry, I had to unmute myself. So for this question, we're just going to ask if you would please discuss in the chat, and we'll try to capture some of your experiences before we move on. And the question really at hand is, have you experienced conflicts working in this very multi-generational environment in your healthcare roles? And I'm going to take a look at the chat and see if anybody is willing to put something there. And I'll take a moment just to give you an opportunity. Even yes or no, if you don't feel like sharing quite yet. Absolutely. As a millennial, others often assume I'm entitled when I'm really there to form collaborations. Yes, this is not, you're not alone in feeling that way. I am a boomer / X and find that the creativity is higher in Gen Z. I also ask for help with some technology. I have been told I'm too blunt by older generations. Someone wrote, I'm not thinking about any specific life experience. Okay, that's fine too. Sometimes hearing others make you recognize future experiences. Well, thank you for sharing. Oh, my skills with a computer are 0. It's embarrassing. Thank you for sharing, Randy. We appreciate that. I'm sure it's not true, but we all feel our own insecurities, certainly. Okay, it's true. Okay, thanks. Oh, these are so wonderful. Let's see. Somebody wrote, millennials and lacking support for projects related to health inequities by older generation. Yeah. I really tire of kids these days comments I hear in med ed. So I'm going to highlight that comment before we move on, because I think that's really getting to the heart of what one of our major goals is to achieve, is that the gaps can be embraced, as a empathetic challenge. And, we can look at what everyone brings to the table, or we can resent what's different. We can resent maybe some advantages that others have that we didn't in our generations. We can look up to older generations and say they're out of touch, they're out of date, or we can say they're wise and they have experience, and they have resilience, and they have much that we can glean from. So I think that's really, really, I really appreciate that comment, because I think it gets to the heart of what we want to walk away from. Because in the end, we don't want to have to work together. We want to work together, and really enjoy and appreciate the experience before we lose it. So with that, I think I'll move to the next slide if I could. And, well, today our discussions really are rooted in the panels and within your experiences that really, really appreciate you sharing. But I did want to mention at least this one particular study, because I felt it was just so relevant. And this was a study that was entitled Working in Fours, Generational Communication in the Emergency Department, and was published just earlier this year. And what the researchers aimed to examine was conflict among different generations working in the American emergency departments. And they sought to understand the themes of conflict, with the goal ultimately to lead to resolutions and understandings that optimize our work environment. The authors distributed the survey through one of their major academic societies, and they received over 700 responses. And so the primary themes, as you can see here, were a work ethic, treatment approach, technology application, entitlement, professionalism, work-life balance, and communication style. And to me, this felt really spot on and is even more reinforced as I'm hearing some of your shares. So I'm going to share just a few exemplary narrative remarks that came through this survey. So in relation to work ethic, a baby boomer wrote, there is a striking difference in apparent work ethic, with many younger workers seeming much less interested in actually accomplishing anything and more interested in punching the time clock as compared to us older folk. And in contrast, and I heard this echoed in the chat, in the category of work ethic, a millennial respondent said, I resent the attitude that residents today are lazy. Older people cherry pick charts. They work slowly. In relation to work-life balance, one millennial ED health caregiver wrote, younger physicians place higher value on balance of family. This is often misinterpreted as laziness or lack of investment in their profession, with negative consequence. So these are just a few of many interesting and prismatic narratives that were shared by respondents. Now, in my role as the chair of what we refer to at Downstate as the Learning Environment Committee, I'm part of a team who are responsible for an online reporting platform that we call Kudos and Concerns. Unfortunately, our concerns do outweigh our kudos, but that's another story. But what I would say is that approximately 30 to 40% of our concerns are sort of rooted in a lack of empathy, understanding, and arguably patience among generations. And I'd like to give one example. So this is under the theme, I would say, professionalism. We recently received a report, a concern report, not a kudos, where a faculty expressed disapproval that a student was wearing a nose ring. They referred to this practice as unprofessional and disrespectful, and asked us, the learning environment, to evoke our school's professional dress policy and ensure that this no longer occur. And what we had to do is we had to discuss with this faculty member that actually our professional dress policy did not preclude that student from wearing a nose ring. And I have to say the faculty member was quite flabbergasted. In preparation for this panel, myself and my co-panelists were discussing this nose ring incident, as I've come to call it. And I thought that Lana expressed really beautifully sort of a generational attitude that I thought, really did describe the underpinning of this conflict. So Lana, I'm wondering if I can ask you to join me and share this explanation, if you could.
Yes, thank you, Elka. Yes, and if I remember the conversation, we were talking about how for a lot of the generations, each generation from the baby boomers onward have had their moments where, especially in their personal lives, they kind of they kind of pushed the envelope, thinking of baby boomers during the Vietnam War, the 60s, civil rights movement, that sort of thing, how many of them really sort of kind of were changing society and really sort of changing that in their personal lives, if not during work. And how as that continuum has continued into current generations, a lot of people nowadays kind of both want to have that in their personal lives, like have this advocacy and this change, but also in their work life. And they really want to show up as themselves, as really of who they are and that sort of thing in their work life. And they feel that that doesn't necessarily affect how they're able to both treat patients and work with people on their teams. And I think really that ends up being like a really difficult thing, is because it really shows that they really want to have that continuum throughout their life and not have be a different person at work and a different person outside of work.
Thank you for adding that.
Great. Thank you, Lana and Elka. So let's go on to our next question. And again, we want you to participate in the chat, if you will. Generations are no longer 20 years. And within a generation, there are desperate perspectives. So before we get into the actual question, I just want to share my personal story. You all can see the question and can start to comment. But for me, as I shared, am the beginning of the millennials. Again, we like to call ourselves Zennials. Oftentimes, we're also mocked by being called the geriatric millennials or the older millennials. But we really do straddle between two generations, which means that for myself and for many of my friends, we have just turned 40. So we're in our early 40s. For us, in our generation, we are starting to recognize that we're reaching our, just say, life benchmarks at different ages than our parents and perhaps grandparents, and maybe even our siblings, who most of them are within the Generation X. And for example, I am 42 years old and I am pregnant, currently almost about 6 months pregnant. I previously before I took the interim chair role, I was the Associate Dean of Graduate Medical Education, the DIO. And I, decided it was time for me to begin my family and started family planning. I did this through fertility treatment, which many of my friends and colleagues who are around my age are doing, because we did wait until our 40s to begin family planning. And right at the time that I recognized that I was pregnant successfully, I was offered the role of the chair position. This was really, really a conflict for me. Do I tell the dean or even the leaders of the institution that I'm pregnant? Is it going to be viewed as something that's going to deter my career trajectory, which, up until this time, I had really focused and dedicated my life towards? Or, what I really felt was the millennial pull of this is who I am, kind of what Lana described. I'm going to come in, strap that baby on my back and keep working. And while right now I'm waddling and doing what I can, I decided to share the news with the dean to say, yes, I am interested in taking on this interim chair position, but I also want to let you know that I'm pregnant and it's not going to stop me. And so we want to know your thoughts. What are your thoughts about reaching benchmarks such as marriage, having children, career trajectory, and how does it relate to the intergenerational work team? We heard a lot in the chat and through the word cloud that oftentimes millennials are characterized as lazy or entitled. And I really think as, a representative, this is my own perspective, of course, of the millennials, is that we're not lazy. That is the perception, but what we really want to strike is this work-life balance. That could be due to a couple of things. One, the trauma of seeing our parents, who were often boomers, not striking that work-life balance, and oftentimes having a parent that had to work quite often, or both parents who had to work quite often and maybe weren't able to participate as much in your rearing. But it also is just the fact that work life has been blurred, right? We have remote work now, particularly with the pandemic. We have remote EMR access so that you oftentimes are at home, but you're actually still at work. And so with this blurring of lines, millennials tend to, in particular, want to set boundaries. When I'm at home, though I'm at home, I want to be at home. I want my work time to be separate from my lifetime. And that balance must be struck. And oftentimes that's confused as laziness and not wanting to take accountability for either their patient care or their jobs in general. So you often say, if I am doing care or if I am working, I like to be paid for it, right? Because I like to make that time worth my value and that I'm giving. And I'd actually like to set the boundary that this is actually work. I'm not going to be doing it for free. Again, oftentimes confused for being entitled. So I'd like to hear what everyone's thoughts are with regards to this intergenerational work team dynamic, how we can improve that, right? How we can set the standard that it's okay to be a pregnant chair and still be valued for my merit and not my status of the wobbling pregnant woman that I am currently. And the fact that we are reaching different benchmarks. The final story that I'll share as everyone's starting to comment in the chat is that I was recently on an emergency department shift, and it happened to be a majority women physicians that were on this shift, my residents, and they began talking about their infertility treatments. I was quite amazed because, again, straddling between two generations, it was something that the older millennials, though many of us have gone through this, didn't talk about. But they were so open, this new generation. They were talking about it as if it was planning a vacation and how they were all going to do egg retrieval. And they were doing this in between their work. I was so impressed that this is what they were valuing, the benefits of being able to, start their family planning when they wanted to, They could start their careers when they wanted to. And quite frankly, they didn't really follow these life benchmarks that oftentimes we feel obligated to meet. It was really, really impressive to me. The other thing that was really impressive was insurance was actually paying for it, right? So it was a much easier conversation for this generation to have to say, yeah, I did my egg retrieval and egg fertilization, and now I feel really good about it because now I can start a family whenever I want. So let's see what some of the chat conversation is. Thank you very much for the kind comments. Let's see, millennials, they're no longer benchmarks per se. If individuals choose to make those decisions, they're delayed, for lack of a better term, meaning we're choosing to be more financially stable, which in the economy we've grown up in has taken a longer time before getting married and having children. Absolutely agree. As a Generation X, not reaching milestones at the right, quote unquote, right time, and or at all, I felt judged and that I wasn't enough if I didn't meet these. I appreciate that the younger generations have brought more acceptance to this and less rigidity. I completely agree. As I said, I identify between the two generations. And of course, when you go to the family events, you hear, you know, so when are you gonna actually get married? My partner and I were together for years before we actually officially got married. It was always the question of, so when are you gonna have children? It was the dreaded question that you knew someone was going to ask you, and it put that pressure on you. And we would always say, when the time is right, or when we are good and ready. There is a cost to fertility treatments. There is, and it's really wonderful that they're now becoming available via benefits. And I'm going to read this final one. I'm a late end of the boomer generation. I have children and grandchildren. I see the changes. Oops. Let's see. I see the changes and hear the comments from administration and frontliners. I think, as you are saying, there is such a huge difference. And the hard part of me says that medicine is a business now. I love the younger generation finds the cutoff. I find it hard in my role that the changes at the time and the fast pace today, it doesn't allow a good communication and follow through. I agree that, you know, where there's this cutoff between life and work balance is very, very difficult. And it does impact the intergenerational team. You know, one thing that I would say is that oftentimes being a leader, I feel personally like it's our responsibility and role to lead the team with how we want it to be reflected. So if that's allowing for parental leave without any, you know, accusation of being lazy, right? Without putting any guilt trips on those who want to take it, encouraging it for not only for mothers, for fathers, for adopted parents, for those who are going through surrogacy, making sure that you reflect the values that you would want to be reflected on yourself. And even if those values weren't the same when you were kind of growing up in the administration and leading during your time, particularly in medicine. So I think that this is something that we should think about, this intergenerational team dynamic and what we're all really trying to seek. So I'll pass it off. There we go.
Teresa, there's one more remark I'm wondering if you wouldn't mind if I read.
Sure,
Because
please.
it might have been below what you saw, but I thought it was quite wonderful. If that's okay, this is from Glenda. Said, I love that you're pregnant and a chair. We need to see this, all caps, in medicine and medical education. We have to talk about the significant amount of diversity that is more in medicine than compared to 40, 50 years ago when physicians were men only. And they go on, but I just thought that was something I certainly would love to see echoed.
Thank you very much. And I'm just sorry, there was just one more comment talking about being single, childless millennial, and I feel by the older generations that my challenges are invalid. I got to be honest with you. I too, for a long time, was childless up until a few months ago. And you do feel that your time, especially, is not as valued as those who do have children. And so that's something for us to think about, really making sure that we have equity and that are not based off of these benchmarks that we all used to carry traditionally. So passing it off to my colleague. Maybe this is Lana. Thank you.
Yes, yes. Yeah, so for our next question, how can the generational continuum contribute positively to the Maya workforce? I've heard a lot of people sort of speak about in the chat, about sort of the almost like these conflicts in ways in which each generation doesn't really understand each other. But I'm wondering, how can that contribute positively, these different experiences and ways of approaching work as well and working in medicine? And for reading the chat, we have some people coming in. I see we all have things to learn and gain from each other, no matter what the age gap. And I would agree with that. There's many different things. And I actually have a story that I can bring up as part of my residency. So I'm a new attending physician, just graduated from residency this year. I was a chief resident this last year at SUNY Downstate, and in that role, I was privy to some conversations, that sort of thing, as well as resident feedback provided to the residency program about various different faculty. One particular faculty member was a psychotherapy supervisor who would be considered part of the silent generation. He predominantly did a mix of lectures and supervisions for the residents. And as part of that role, the residents frequently would give him a lot of commendations and like really sort of awards for his supervision, thought that he was excellent. But in regards to his lectures, there was concerns that some of his lectures were, and I'm quoting, 20, 30 years old and did not reflect some of the new sort of ways in which psychotherapy as well as cognitive behavioral therapy could be used. And so as part of that and kind of communicating with this particular faculty member, I remember him mentioning that his plan was to work until he died. He had no plans on retiring. This is what he loved to do, and he was planning on doing that. And so trying to change and trying to both reflect both the resident feedback, but also recognize the strengths of this particular faculty member through a lot of conversations as well as work together, we generally sort of worked on really focusing on the strengths of this faculty member, really what he brought, which was a lot of value to the residents and a lot of value to their direct supervision and working with them individually. And it ended up, I think, really enhancing these opportunities that this particular faculty member was able to bring, while also not helping him not feel kind of pushed out or feeling like what he's bringing wasn't relevant, which it was, but specific ways in which he brought it were found to be more helpful than others. Let's see here. Let me see if I can read a couple more. There should, you can never fail with a little curiosity and openness to understand. I would agree with that. I think I'm really being curious about what our older faculty members provide, baby boomers, that sort of thing, could really be, I think, very valuable, and they really have a wealth of experience that they can provide us. If we focus on strengths over differences, we can learn to share projects and work together to support our patients. Growth and development comes from different perspectives, joining forces for shared goals. I often think that the older generations have to defend and protect the way it was, so they protect themselves, perhaps from some of the sadness and guilt they may feel. That creates a wall between generations that should be bridged. We can grow from an honest communication between generations rather than defensive stances that don't move us forward. And I agree with that. With the example I gave, I think it was at first defensive, but as like more feedback was brought, as these conversations continued and trying to be empathic to the place in which everybody was coming from, I think we were able to move forward in a way that really benefited everybody.
You know, Lana, you reading the chat, basically the next question that I was going to discuss is being answered right now, because everyone's talking about working with younger and older generations, which goes along the hierarchical structure in medicine. So I think we can actually skip this question because we're already discussing it, and go to basically talking about how we can actually use strategies for increasing generational diversity and to have more empathy in the workplace, if that's okay.
Definitely go ahead.
Thank you, Lana. So this is just wonderful. This is what we wanted to spark this conversation. So thank you guys for commenting in the chat. Now, some takeaways for what we can do is to basically come together and realize that when we're trying to recruit new people to the workplace or in the learning environment, new residents, new students, new colleagues, we have to adapt our recruiting strategies. So to not just post them on websites, perhaps, or just emails, but also social media. Take advantage of the technology, take advantage of these new strategies to reach a broader range of generations and age groups. And then avoid making age-based assumptions and stereotyping. Perhaps someone is older, perhaps they identify as boomer, and we think that they may not be able to text very well, but there are some people in that age group that are more tech savvy than I am. So listen to your colleague and find out what they want. Listen to the student. The student could be older than you, the resident could be older than you. Listen to not just doing things that you think they want. Ask them what they want and then implement those things. Customize your approach for each colleague or learner. Adapt varying communication styles. Refine your techniques for delivering feedback. So some people like face-to-face, sit down, have an actual meeting, whereas others just want to text like, hey, good job with that, you know, strong work, and we're satisfied sometimes. So that depends on the individual, not necessarily just the generation they belong to. Assemble age diverse teams for projects, cross-generational mentorship programs. Again, this doesn't necessarily mean that the mentor is the older person. This could be a younger person who is more experienced. But either way, everyone can benefit from sharing ideas with respect and from a sense of curiosity without judgment. And then establish diverse retention practices. So just as my colleagues have mentioned, having things implemented for IVF, or for someone to be able to take off for sick leave, or considering that some people may have children, some may not. Just curtail it to a broader range of people than limiting it and just feeling that it's very rigid in your expectation of what people want. Just make it more variable. So again, these are just some strategies. I'm sure you could put in the chat other things that you think would be beneficial for increasing diversity and inclusivity when it comes to generational, to different generations. Thank you. We can move to the conclusions. I think this will be you, Melanie.
Yes, thank you for that, Jody Ann. So, I mean, there's still so much that could be discussed. And of course, in a short time, we can't hit on everything, but I think I've seen a lot of the things in the chat that also wrap up a lot of the sentiment in focusing on the strength-based approach. And I think where empathy really comes in is really being able to understand the idea that, different generations have very significant events or cultural, parenting styles, educational frameworks through which they were impacted, or which have formed the way that they see the world, the way that they approach work and learning, and one is not necessarily better than another, and we can all learn from each other. But I think having that understanding can be really helpful in breaking down those barriers of us versus them, or the kind of okay boomer or kids these days, because what it really comes down to is the differences in values. And this is going back to that concept of the generation gap. And if we can understand that different generations have different values without looking at those differences as right or wrong, but just different, I think it can be a lot easier to look at what are the strength-based approaches in an intergenerational team, and how can we really benefit as a team being stronger than the sum of their parts individually. And I think there was, we often talk a lot about, the millennial stereotypes of being lazy or entitled. and I think there's a lot of work being done on how to be more supportive or more understanding, but I think we also have to look at it the other way and understand, we're in a much quicker change of pace in technology and in just the way that, Gen Z and younger millennials and the generation that's upcoming currently are going to face the world. It's not necessarily going to be in this traditional like sequential steps of life, and so they're really moving into a world in which choice and shifting jobs and shifting roles is probably going to be a built-in part of what they have to face. Whereas boomers and the generations above, there really was a lot of stability, and so we have to understand that in understanding why we have some differences in what we define as professionalism or work ethic, and work-life balance and the value of work-life balance. And so I think that's, bringing in empathy is one of the key areas that we need to start in terms of moving from generational diversity to generational inclusion, and being careful that we're not we're not excluding the generational differences in a way that can be sometimes almost societally acceptable ageism in keeping these categories as different and us versus them. And that doesn't necessarily help the work that we're trying to do, which is being able to understand each other, support each other, work within a team, and really try to help support all members as they move through the different phases of their work life and of their home life. And so I would welcome anyone who has any questions or comments to put it in the chat. Again, there's so much more that could be said, but I hope we've at least scratched the surface for this topic.
Melanie, there is some really wonderful comments in the chat. Renee wrote, everyone brings value and perspective to the table. I encourage people to have professional friendships in every decade of life. I affectionately call these, quote, phone of friends who can add perspective and dialogue in a more personal and in a less intimidating space. And what I responded was that, this is our perfect example of how much we agree, because I hope my panelists will agree that, we're, for example, a group of hospital leadership, educational leadership, more junior attendings, residents. And when we come together, yes, we try to be productive, but we share a ton. And we think it, at least I do, and I hope my colleagues agree, find it really fun. And I always walk away enlightened. So it's really, so I cannot agree more. This is how we all grow, and this is how we do better. I mean, we're supposed to be here for our patients, for our students, for our trainees, but for one another as well. And it's all wrapped up in that concept of joy, of learning and productivity and support, mutual support.
So the worst part of my job is I'm the timekeeper, and I hate this moment, but it is time. I want to thank the panelists and the participants in a wonderful conversation that brought meaning to this entire conference. And so thank you all for participating. We appreciate both the panelists and the attendees' participation. And we will take a quick 15-minute break, and then please refer to your attendee hub for the link to join your next breakout session. So from my heart, thank you all.